This is how we start. We usually start from the beginning. Where were you born?
In Karachi.
In Karachi. And how was your childhood like? Were you a very silent kid? Were you a very shararti kid? What kind of a kid were you?
Beta, that was a long time ago.
Sure.
I cannot recall much of it, but I don't think I was a very naughty kid. I was the firstborn in the family, so I was a pampered child.
Okay.
And that's really all I can remember.
What is there like? Are there some things that you remember about your childhood that when you think about brings back really good memories or something that you can share with us?
Well, there were lots. Everyone carries good memories from childhood. I cannot point to a specific one, but my childhood was a happy one. I don't recall it as a. So it was an interesting childhood. My parents were both in the armed forces. So my childhood was spent shifting cities every 2 years.
Yeah.
So I was born in Karachi, and then I have been to most of the major cities of Pakistan.
And where was your schooling from?
Again, I changed about 8 or 9 schools in the 10 years that I was in my schooling. So from Karachi to Kharia, from Kharia to Dhaka, from Dhaka to Multan, from Multan to Quetta, from Quetta to Ahmedabad, from Ahmedabad to Rawalpindi, from Rawalpindi back to Karachi.
How was that? Having to make new friends?
Yeah, so obviously, in retrospect, when I look at the present day, I think it was not the best experience to have as a child.
Yeah.
But at that time, it seemed like it was the thing that was done because we were in the armed forces. My parents were in the armed forces, and this was sort of routine. You just shifted every 2 years.
So usually I think you went through the same course as well. Okay, when you're about to go into 9th and metric, you have to decide कि आपने engineering लेनी है या biology लेनी है. So what made you go towards biology?
Right. So both my parents were doctors, and I did think in terms of engineering. Those were the only 2 options at that time. But I did not find myself to be very good at maths.
Okay.
And I think that sort of made the decision that it would be probably better for me to do biology.
Okay. And after that, you did your inter. And then which med school did you go to?
Dow Medical College.
And how was that experience?
Again, interesting. This was the time when a lot of political upheavals were taking place in Pakistan. So my class actually took 7 years to graduate because 2 years were lost while we were in medical college due to the political unrest and the exams being postponed. That time, Dow Medical College was our class was something like 400 medical students.
Whoa, okay.
Right? And that was a bad time politically and generally speaking in the country. So I can't recall even 20% of my medical school colleagues because there was such a big class.
Yeah.
So that was what it was. It was an interesting time. I was young and we had friends, and Karachi used to be a better place. I'm talking about early 80s.
Yeah.
Started my medical school in 1980. It was a good time. Time to be in Karachi.
Was it in med school that you knew that you were going to be a surgeon later on in life, or you were more inclined towards medicine?
So again, I was never very passionate about any specific aspect of specialities, but my parents sort of, I think, subconsciously had been working on me, and being the elder, my father was a general surgeon in his earlier days and then left. My mother was a gynecologist, so it was just the unwritten sort of decision in the house that I was going to become a surgeon if I became a doctor. They never pushed me, and I don't remember deliberately making a choice between medicine and surgery, but it seemed surgery was the thing to do because that's the way it was.
And then you did your internship here?
I did my internship at Dow. I had 6 months of medicine, 6 months of surgery, and then I did a stint at Jinnah as an unpaid postgraduate. And during that time, I did my PLAB and I did my FM GEMS. I wasn't sure whether I was going to go to America or not. I got married during that time. My wife is a gynecologist too, so we both did our FM GEMS and our PLAB. And then I opted to go for, because I really wanted to, by that time, wanted to do surgery. I opted to go for Britain because all our colleagues who were going into America were ending up being physicians. Because it was at that time very, very difficult. It still is, but even that time was difficult, and I did not want to not become a surgeon. So I ended up going to England instead.
And how was that experience for you?
It was good. I mean, it was very different from what we had seen medicine and surgery as. It was a very rapidly changing environment for general surgeons at that time. Laparoscopic surgery had just started when I started my surgical training. This was the early 90s. So there was a lot of excitement in general surgery. When I had decided to go for surgery, I actually thought I would become a cardiothoracic surgeon.
Whoa, I didn't know that.
Yeah, so the first surgical rotation that I took up in England was actually a 2-year SHO rotation with 6 months in cardiothoracic surgery.
Oh, interesting.
Right? This was the Guy's and Thomas's SHO surgical rotation. During that time, I got a chance to do a 2-month locum in the Department of Cardiothoracic Surgery, where I was going to do my 6 months. And in those 2 weeks, I realized, or not 2 months, 2 weeks of locum, I realized that I don't want to do this. Right?
What made you?
It was just that 95% of the operations at that time in that unit were cabbage.
Yeah.
And I realized that I can't do this.
Yeah.
So I opted. I went back to my coordinator, the rotation coordinator, sat down with him. He was the postgraduate lead doctor, and told him that, listen, is it possible for me to do some other 6 months to complete my fellowship requirement? And they were quite nice, and they agreed to let me do ER. So I did 6 months of ER instead of cardiothoracic, and sat for my fellowship again.
Interesting.
Yeah.
And so where did your way come up to surgical oncology?
That happened here. That happened at AKUH. I mean, I don't know if you know, but I came back from England after 6 years of postgraduate training, so about the same time as a residency, 5-year surgical residency. So I wasn't very experienced. I did a year of research at Hammersmith Hospital, did an M.Sc in surgical science from London University as my last bit, which was not a practical operating exposure. It was a bench work with molecular biology as my major. So I came back and I had applied to AKUH. I was lucky enough to be selected as a senior instructor. And then I was lucky enough to end up joining up with Professor Mushtaq, who at that time was the main surgeon doing oncological work. And I worked with him, I think we were together for about 5 years, 4 or 5 years. And over that period of time, I slowly developed an interest. And beyond that, it has never been we are not a specialized unit. It's just been something that's slowly evolved. My interest has evolved, my practice has evolved, and I'm doing a fair amount of oncological work, but I'm a general surgeon still.
So you mentioned that you got married while you were about to transit from Pakistan to another country.
Oh no, much before that. You will be surprised when you hear when I got married. I got married on my last Viva, which was gynae and obstetrics.
Okay.
Because our exams got postponed by 3 months. So we had already planned the wedding and invitations had been sent and all that. My wife and myself are class fellows.
Oh, much lucky.
So it was all decided, and then the exams kept getting postponed, and we couldn't withdraw the invitations. People were coming from this far away. So we opted that we'll just go ahead with it. And it so happened that my last Viva was on the day of our wedding.
Interesting. So how did you manage, because getting married is not easy, and then having that life, and then having to have a training life?
So time passes. You adapt. We were both doctors, so we understood what it, and she was a gynecologist in training. So she was doing her gynae training, I was doing my surgery training. It wasn't easy, and all credit goes to my wife. I mean, more than me, she's the one who held the fort, to say. We had our daughter 2 years into our marriage, and so Sadia, my wife, is the more sensible and practical one out of the two of us. So she did well. She held on to she got a place in Chertsey near London. and she stayed in one place for 5 years. I, on the other hand, kept shifting jobs. I had the guy's surgical rotation, then I did 6 months in Church C as a urology resident, and then I did 2.5 years as a surgical registrar in the northern areas, northern region registrar rotation. Then came back and did a year at Hammersmith as a fellow doing an M.Sc.
Nice.
So I was the one who was running around. She kept our home. She brought up our daughter, and she really
held the fort.
She kept the things going.
Nice.
Yeah.
Mashallah, you're in a position where you're mentor to a lot of people. You've been mentored by a lot. How important do you think mentorship is in one's career?
That's a good question, but a difficult one to answer. Mentorship has always been part of growing up in a profession, right? You come across people who help and guide you. It's become more formalized, but I don't know whether it becoming formalized improves on what it was from the beginning. Mentorship is something you discover, and in my life it was totally a matter of chance, that you come across an individual who inspires you and then who has the grace to give you the attention and time that you deserve.
Yeah.
So that's how mentorship always was, to my mind. But over the past 10, 15 years, it's become more formalized. It's become, we've got actually official mentors.
Yeah.
I don't know if that serves the purpose that mentorship is supposed to serve. I don't think it is, it's not a prescription that you become a mentor and you start mentoring someone. I don't think it works that way. But that's my view.
There's a lot of talk about work-life balance these days. What do you think is work-life balance? And do you think, what is your perspective about that?
So, as you realize, I'm from a time frame where these terms were not invented, right?
Yeah.
So I don't know what this term work-life balance means. The profession that I took up and I became involved in was my life. It became my life. I don't know what work-life how would you distinguish the two? This work that I did was my life, right? Yes, there were other aspects to my life as well, and those were important. But when you're a surgeon, I think your emotional, your intellectual, and your physical involvement has to be all the time. It's not something that you do part-time. It's not something you leave in your office and go home without. I would still be thinking of my patients at home. If there was a complication, I would be miserable for days at home. You can't leave it in the hospital. So I don't quite understand the term work-life balance. If you take up this work, then you work and life happens around you.
So mashallah, say you have a daughter who's also a surgeon.
Yes.
How is that for you?
Well, it's interesting. I see her going through the difficulties that I must have gone through as well. I've forgotten about them, but I've been reminded of them again with her going through them. It's a difficult thing. She's a general surgeon, much to my angst. I tried to convince her not to take it up, but I couldn't persuade her. So she's a general surgeon. She's, mashallah, doing well. She's done her boards and all. But it's a lifelong commitment. She's now had a son recently, so she's finding another aspect to life which she hadn't considered before. Just like and that's what I keep when I see young women coming into surgery. I ask them, have you thought this through? Do you know what you're getting into? Do you know how things will be future? Which is not something men have to consider often. I mean, men sort of just look at the profession. But women have to be much more pragmatic about it, I think, which is a shame. They shouldn't need to have a separate methodology, but that's practical life.
Also, have you, I don't know, this is something that I felt, that the generation that that's coming, that's going to be our future, there's a gap between us and them. What do you think, how do you think, can this gap be shortened or lessened, or what is lacking?
I don't know. I think gap in generations has always been there. This is nothing new, but every time a new group comes there, if they feel that this is something new. This is not new. I mean, I remember being a young person and looking at the grown-ups around me and saying there's a generation gap, these guys don't understand what we need or what we want. So the generation gap is always there, and it's part of as you move through life, your outlook, your approach, your things change.
Yeah.
And when you're moving into life, you are just not aware of all that. And the change that you are seeing, you see, gosh, this and that's a gap. I can't relate to this. But I think this is just the way life is. It's not peculiar to this generation or the last one. People make it sound that way, but I think this is the way it has always been, especially with the rapidity of change that's coming about. Previously, 100 years used to go by and nothing used to change.
Mm-hmm.
So there wasn't as perceptible. But now the change is much more rapid, and maybe that's the reason.
Yeah. So we know that you have some extracurricular, and you're very great at that. You play instrument, and how have you had the time to at least pursue that for a while? And did you learn? Where did you learn it from?
So again, like you were just telling me, there's 24 hours is a long time, and you can do a lot in it. So yeah. So I've always admired the sound of the sitar as an instrument. And about 20 years ago, I had the opportunity of coming across a ustad, actual master, and who was willing to teach me.
Nice.
So I started with him, and that was 20 years ago. And I've been playing since then. I've been lucky enough to have one excellent ustad who was a renowned Pakistan person. His name was Imdad Hussain. And then I was lucky enough to find another ustad. One Imdad became too old. Another great Pakistani musician, Sajid Hussain.
Oh, nice.
He's started to teach me. We used to meet twice a week. He would come to my house. We'd have an hour. And I really used to enjoy, not that I could play, but I could follow. And he was kind enough to be slow and let me follow him.
Nice.
And that's what I enjoyed. And I just like the sound of the instrument. I'm no musician. I have no music in me, but I enjoy. And technically, I can pull the string and make the sound
That's you being very humble, by the way.
No, I'm not being humble. I'm being honest. I don't have a musical talent. I can technically play the thing, but I can't make music. And I still enjoy it. I still look forward to. Unfortunately, Sajid Hussain passed away suddenly a year ago, and I was devastated for many months.
Mm.
But again, I just called it luck. His younger son, who's a good sitar player, has joined up with me.
Nice.
And he now comes and I play with him.
Nice,
so
very
it's nice, yeah.
So last question, is there a message that you'd like to give out to your residents, people who look up to you, the younger generation?
So I don't think I have any specific message. I think my message to people coming into medicine and surgery is, you need to be honest with yourself, and you need to ask yourself, why do you want to do this?
Mm-hmm.
And if your answer is because this is what I want to do and there's nothing else I want to do, then it's the thing for you.
Yeah.
But if you think you're coming in because your parents want you to do medicine, or because it'll be a path to go to America or make a better living, I don't think those are reasons to want to come into medicine, and specifically in medicine in surgery. This is a life's commitment. The stress of it, the whole spectrum of what you have to face and go through is not worth the effort that you have to put in if you're not really into it. So my message would be that. Excuse me. So yeah, think about it. And unfortunately, our environment doesn't allow students to develop a critical thought process. Secondly, they come into medical college at 18, which is, I think, too young for you to be able to think through into the future as to what your needs are. So I think it's a difficult situation for youngsters at the age of 16 to decide whether they want to do medicine or something else, and then at the age of 18 to decide to come into medicine. And then once you're in it, it's
no going back.
Yeah, it's a lot of effort, and you can't change track.
Mm-hmm.
Most people don't.
Yeah. Thank you, sir. Thank you so much for
joining us. Not at all. Not at all.
You.
I hope you find it useful.